This video will show you how to pass a nasogastric feeding tube, confirm tube position using pH indicator strips, and flush the tube with water. For the purpose of this video, we will refer to this tube as an NGT. An NGT is usually considered a short-term feeding tube. It is passed by a healthcare professional, dietitian, nurse, or doctor that has the relevant experience to carry out the procedure. It is inserted via the nose and into the stomach. It is important to get your equipment prepared in advance of the procedure. You will need a clean trolley, disposable bowl, a nasogastric feeding tube. Within NHS 5, this is usually an 8 French size tube, pH indicator strips, a 60ml enteral syringe. A 20ml enteral syringe may be needed if difficulty in obtaining pH. For those patients that have had a recent negative COVID-19 status, staff are advised to use droplet precaution PPE, fluid-resistant mask, apron and gloves. Staff can wear full AGP PPE if they have any concerns. Finally, you will need a container of fresh drinking water and a small dressing to secure the NGT in place. For patients who are not nil by mouth, it may also be useful for the patient to have a drink to help with the passing of the NGT. Place all your equipment on a clean and flat surface and carry out hand hygiene. The patient should have a comfortable chair to sit on while the NGT is being passed. Explain the procedure to the patient and gain informed consent. Agree a suitable stop signal with the patient, such as raising in a hand in case the patient wishes to stop the procedure. Ask the patient whether they have any allergies, such as polyurethane or latex, and whether there is a preferred nostril for the NGT to be passed. Sit the patient upright at a 30 to 45 degree angle. Keep the head in a forward-facing position if possible. To gauge what length the NGT will be passed to, place the tip of the tube at the nostril and measure to the earlobe and then to the episternum, the distal end of the sternum, and add 5 to 10 centimeters. Insert the NGT into the nostril, gently advancing inwards and backwards along the floor of the nose continuously as tolerated. If the patient is not nil by mouth, you may advise the patient to start sipping water to aid passage of the tube into the nasopharynx. If the patient is nil by mouth, no fluids can be taken orally. Advance the tube gently until it reaches the predetermined mark. It is important to note you may need to withdraw if resistance is felt as the tube is advanced. Withdraw the tube immediately if the patient develops signs of respiratory distress, coughing and shortness of breath. Secure the nasogastric feeding tube in place by asking the patient or a member of staff to hold the tube. Remove the guide wire from the tube. Withdraw some aspirate from the stomach using a 60ml enteral syringe. A 20ml enteral syringe may be needed if difficulty in obtaining an aspirate. Place a small amount of aspirate on the pH paper. Read the pH indicator strip correctly. A pH of 5.5 or less confirms gastric placement. If you are unable to obtain an aspirate or pH is greater than 5.5, refer to NHS 5 Unable to Obtain Gastric Aspirate Checklist and document in notes regarding difficulty in obtaining an aspirate. A nasojejunal feeding tube, NJT, may need to be considered if difficulty in confirming pH persists and is clinically appropriate. Once gastric placement is confirmed with a pH of 5.5 or less, flush the NGT with water, 30 to 50 ml or as recommended by the dietitian. Secure the tube to the patient's nose or cheek using appropriate fixation. Dispose of equipment as per clinical waste policy and perform hand hygiene. Record procedure using correct documentation. Record type and length of tube, centimetre mark at nostril, and pH aspirate obtained. Complete the insertion sticker and put in the appropriate patient care assessment and admission record. Hospital only, or healthcare professional notes. Thank you for watching our video. Any further information, please refer to the nasogastric feeding tube policy that can be accessed via link, or you can contact the dietitian and/or nutrition nurse.